The world was not prepared for the outbreak of this virus. West Africa had never had a case of Ebola, and previous outbreaks of Ebola had been generally in very remote, isolated areas, and the world had developed, WHO had developed, national authorities had developed a certain approach to treating those outbreaks, which was 100% successful in the past, 100% success rate. So when this outbreak occurred, those same approaches were applied to it, and the expectations reasonable that that approach would work. Unfortunately, the virus got out ahead of everyone for a whole range of reasons. And when it started spreading geographically, and because of the much greater movement of communities in the areas where the virus first struck, that geographic spread created complexities to the response that had never been present before. We're facing lots of obstacles. The single greatest one is the mobilization of human resources, and President Karoma identified that last night in our brief, or yesterday afternoon in our briefing with him, and he was absolutely right. International personnel and national personnel, we have very large requirements for human resources. On the international side, we need trained medical personnel. We especially need experts who know how to run these facilities, who know how to manage them, who know how to protect the healthcare workers in them from getting sick. Doctors and nurses are extremely important. The management of these facilities, it's a very particular skill and requirement, and extremely important. And there are very few people with the requisite experience and skills to properly run a facility, and it's that management that will keep the workers safe and have ensure the highest possible successful rate of treatment. And that's where we really need help from the international community, from NGOs. It's going to take some time, it's going to take a lot of work, it's not going to be easy. Those targets that I just mentioned for December 1 are extremely ambitious, extremely hard to meet.